Knock knock. Hi Bob, my name is Sarah. I'm going to be your nurse today. So I'm providing privacy and washing my hands as I enter the room. So today I'm just going to be assessing your chest tube site and your drainage collection chamber. Is that okay with you? He says yes. They've been assessing it and changing the dressing multiple times, so he doesn't have any questions or concerns. Can I have you state your first and last name and date of birth? And he tells me, and it matches my chart. So is it okay if I have you just sit really still? I'll just expose the part of your dressing that I need to see, and I'll keep the rest of you covered. Is that okay? And he says yes. He's able to sit still, and he is okay if I expose part of his dressing. So as I'm looking at the dressing, I am assessing his vital signs, oxygen saturation. So I'll do a full set of vitals. I'll listen to his heart and lungs, and I will assess his respirations, including any signs of labored breathing, cyanosis, pursed lip breathing, anything like that. And everything sounds good. And a lifespan consideration would be children 0 to 2 will have abdominal breathing, so that's something just not to be concerned. That's normal for their age. So I'm going to wash my hands, put on clean gloves, and in the room with me, I'm always going to want to have a hemostat, a bottle of normal saline or sterile water in case the chest tube becomes disconnected from the suction, the drainage container, and put it in that right away, and then also an occlusive dressing in case the chest tube were to become dislodged and I need to put a dressing on immediately. So I'm going to assess the site for any drainage, signs of infection, redness, irritation, swelling, and crepitus. So I'm just feeling, I don't feel any signs of crepitus or any drainage at all in the tube. There's no signs of any air leaks or any other irritation. Are you having any pain or discomfort at all? And he says no. And there's no signs of crepitus. If there were, I would mark that on the chest and make sure that it doesn't spread for next time. So I'm going to go along down the tube, making sure everything's connected properly. There's no signs of any leaks or disconnections. It's draining well. There's nothing hanging on the floor, and the chest tube is always to be below the level of the waist. So everything looks good, everything's connected. I will observe the drainage in the chamber, and I will make sure that I note the characteristics of that, the color, consistency, and type of drainage, and then I'll mark the amount. And everything looks good with that. I see the dressing doesn't need to be changed. There's a date and label on it of who last did the dressing change. And everything looks good with that. Are you having any pain or discomfort? And he says no. So it's important to reposition the client every 1 to 2 hours for comfort, not only comfort, but also to promote the proper draining of the chest tube, and also assess his pain with moving and also without moving, so I can manage that and plan for activities as needed. Do you have any questions or concerns? Are you doing okay? And he says yes, so I might want to place him in a semi-Fowler's position for proper draining, and I'll leave him with his call light. He doesn't have any questions or concerns. Everything looks good. So that will be it.